Hi everyone, welcome back to my channel. This is Dr. Shahan's class and I am Dr. Shahan Laik, MBBS, and today in this video I will teach you about Maffucci versus Ollier's disease. Now you will ask me what is Maffucci and what is Ollier's. So basically these two disease, you can see in the picture the right hand, look at the right hand, you can see small rounded tumors, and basically this occurs in hands. So what is this Maffucci and what is this Ollier's? We will learn about it and we will distinguish between Maffucci and Ollier's disease. So in the end of this video you can understand the difference between Maffucci and Ollier's disease. Maffucci versus Ollier's disease. Now, before learning Maffucci and Ollier's disease, we must know what is Enchondroma. Now, you will ask me, why should I know about Enchondroma? Because Maffucci and Ollier's, both this syndrome or both this disease contains Enchondroma. So what is this Enchondroma? Enchondroma is actually benign cartilaginous tumors or neoplasm that generally occur in the intramedullary cavity of a bone. And which bones are affected? Remember, 50% of the cases, the bones of hand and feet are affected. Hand and feet are affected. Most commonly, where it occurs, most common bone tumor in the hand is Enchondroma. Remember, most common bone tumor in the hand is Enchondroma. This is benign tumor. Remember, benign tumor. Enchondromas are benign tumor, cartilaginous tumor, and it occurs where? In the intramedullary cavity of bone. Intramedullary cavity of bone. And generally, what is the presentation? The presentation is swelling, presentation is pain or pathological fracture. So either fracture may be there, pathological fracture, or swelling or pain may be there. So whenever Enchondroma is there in the picture, that is the benign cartilaginous neoplasm is there in the picture, then we will think about two important differential. The two important differential are Ollier's disease and Maffucci syndrome. Ollier's disease and Maffucci syndrome can be diagnosed only by MR scan. Now, what is this Ollier's disease? I already told you that we will learn about Ollier's disease and Maffucci syndrome. And in the end of this video, you can distinguish and memorize with mnemonics what is Ollier's disease and what is Maffucci syndrome. Ollier's disease is basically a condition which contains multiple enchondromas. So it contains many enchondromas. Enchondromas, I told you, cartilaginous neoplasms of hand, small bones of hand. You can get multiple enchondromas. And what is then Maffucci syndrome? Maffucci syndrome also contains multiple enchondromas, but they are associated with multiple hemangiomas, multiple angiomas. So Maffucci has multiple things. You can remember like that. Maffucci is M. So it contains multiple things. What are the multiple things? One is enchondroma, another is angiomas. So both enchondroma and angiomas are present. Enchondromas and hemangioma, but Ollier's is only enchondroma. Now look at this picture. This picture is basically showing that how Ollier's disease and Maffucci syndrome actually present. Look at the picture A, that is the above picture. You can see how gross it appears. And look at the radiology and pathological pictures. Now I will give you a mnemonic of Maffucci Syndrome. The mnemonic of Maffucci Syndrome is BOSE. B-O-S-E. BOSE. What is BOSE? B means brain glioma. B means brain glioma. O means ovarian carcinoma. O means ovarian carcinoma. S means soft tissue hemangioma. S means soft tissue hemangioma. E means enchondromatosis. E means enchondromatosis. So remember this BOSE mnemonic, B-O-S-E. B means brain glioma. O means ovarian carcinoma. All these are increased risk. Increased risk of brain glioma, increased risk of ovarian carcinoma. S means soft tissue hemangioma, and E means enchondromatosis, enchondromas. So this is the mnemonic by which you can remember Maffucci syndrome. So once again remember M. M means Maffucci. M means multiple things are there. What are the multiple things? There is two important things. One is multiple enchondromatosis along with soft tissue hemangioma. But remember, this soft tissue hemangioma is not present in Ollier's disease. Soft tissue hemangioma is present in Maffucci syndrome, and that is why it is multiple. M means multiple, M means Maffucci. So Maffucci, M means multiple things. Multiple things. What are the things? Enchondromatosis is there. Along with that, soft tissue hemangioma is also present. Soft tissue hemangioma is also present in case of the Maffucci syndrome. But what happens in case of the Ollier's disease? Ollier's starts with O. Ollier start with O. O means only. O means only. Only enchondromatosis. Only enchondromatosis. Only enchondromatosis is present. Remember like this. Only enchondromatosis is present. Where it can be found? It can be found in the hands and feet. In the hands and feet. One extremity is affected more than the other. Look at the picture. One extremity is affected more than the other. Ollier's disease. Right side picture you can see the one on the right, that is more affected than the left. So always remember this mnemonic. This is very important for NEETPG and INICET examination. So Ollier's disease, Ollier's means O means only enchondromas is present. Next is Maffucci syndrome. Maffucci means M means multiple, that is enchondromatosis plus hemangioma, or you can remember like this Maffucci starts with Ma. So enchondromatosis with hemangioma. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. This channel contains so many medical disease video. All are free. This I have created for helping the MBBS students in studies. Thank you so much. This is Dr. Shahan signing off.